everyone, so basically today I'm just going to do a video talking to you guys, looking back on my first year uni experience, giving you guys some tips and advice if you're going into nursing or mental health nursing like what I'm doing, and it's basically just things I wish I'd known going into it. I think because when I started this degree there was hardly any information about this course, and there was hardly any YouTubers giving like advice videos, so here I am. I thought I'd do that for you guys. So the first thing I'm going to say is, going into this degree I was really worried about my lack of experience in this field. I did have maybe 6 months experience working in a care home, so I wouldn't say experience is required, but I'd say it's really helpful just to get things like personal care, moving and handling, even just assisting people with lunch and dinner times. Like, that is all good experience. Things like communication as well. It's just good to have that going into the degree. Like, it's fine if you don't have that because that's all stuff you learn at uni before you go into placement anyway, but it's different learning that in a classroom compared to actually doing it practically. Okay, this is something else that I wish I had started right from the get-go, but learning your medications, like drug classes, is so important, just because you have got medication assessments in year 1, you've got a medications management to get signed off at your placement, so you need to be learning medications, the medication classes. So if you're doing mental health nursing, it might be ideal to sort of get like I'll show you guys. Right, so I've got this folder here. I've called it a drug log, and basically I've got like these little sort of like dividers down the side. Ooh. So like all these dividers here, and then each colour is a different like class of medications. So I've got, the first one is mood stabilizers. So for mood stabilizers, if I come across any in placement, I'll go home and then I'll write like a little bit about that specific drug and then put it in the right slot. So yeah, I've got that, and then I've got stuff like SSRI, antidepressants, like the typical and atypical antipsychotics. So just section it all off and then start trying to remember like the common side effects, the contraindications, what the drug is actually used for, just all stuff like that, just like so you have a rough idea of what you're actually giving to people, if that makes sense. So if a patient asks you like, what is this drug, what does it do, then you'll be able to tell them, because you really like, that is something we should know. But 100% start that like in the first trimester of your course. Like, I started it in the last trimester, but I think that was a bit too late. But for every single placement you do, just write down the common medications that you've seen and just put it into this drugs log, and then by the end of the 3rd year you'll have all these different medications that you know and that you've learned. One of my mentors was actually telling me that she had to fail a 3rd year student just because they weren't clued up enough about medication, about common medications used in mental health settings, common side effects. So yeah, there is potential that you could fail your placements if you don't have that knowledge. So before I started this degree, I was hearing some like nightmare stories about mentors that were so like horrible and like didn't want students, and like people were like really struggling at placement. And I'm sure like I haven't actually come across any nurse that is like that so far, like luckily. So yeah, I'm gonna say it's really rare that you're gonna come across a nurse that completely dismisses you. I think as long as you're showing interest and taking initiative and taking control of your own learning, then I think any nurse will be willing to teach you if you're willing to learn. Another thing that I sort of did realise but didn't expect going into the degree was how much sort of general nursing us mental health nurses also do. It's as if we're getting a dual qualification, but we don't get a dual qualification at the end, if you know what I mean, because my whole first year pretty much was general nursing. There was hardly any mental health. It was pretty much A&P, bioscience, and then my placements were a lot of general nursing incorporated into mental health. So the first year placements you might get could be something like older adult mental health, because there's going to be a lot of physical health within that as well, just because older people tend to have more physical health problems, chronic conditions, things like that. So yeah, just be mindful that there is probably going to be a lot of science in the first year, but second and third year will definitely be more sort of specialised in what you want to do. Like some things you might not find interesting, but don't give up, because you will get onto the mental health stuff, if you know what I mean, because obviously we come into mental health nursing because we're interested specifically in mental health, but you do need like an all-round knowledge. So yeah, they will be putting a lot of general nursing into your training. Something else I'm going to stress is that you need to revise before you go onto your placement about what the area you're going into is, like important things you need to know, just because we do like 3 months of theory and then we get thrown onto a placement. Like 3 months isn't enough time to learn absolutely everything you need to know, obviously, but say if you're given a placement on a specific ward, just make sure you look up that ward, like what they do, like what sort of people work there. Just try and do some thorough research on what you're actually going into before you go, and don't expect to be busy all the time as a student on placement, especially in your first year, just because you might, if you haven't had much experience in healthcare, then you might feel a bit like a lost puppy sometimes. But if you are ever like stuck and you have nothing to do, and like the ward you're on, it generally is really quiet, or if you're in like a community setting where you're in an office and you've sort of just like there genuinely is nothing to do, just take that time to do some extra revision. If you have assignments due, do those assignments. Find someone who's free to ask some questions and just have a chat with someone. So yeah, if it's quiet, don't just sit there on your phone. Basically do something productive is what I'm trying to get at. We also have these documents we need to get signed off on placement, and if any student nurses are watching this right now, you'll literally understand the pain of getting your documents signed on placement. Just because, right, nurses are so busy on the wards, like your assessor hardly has any time to do their own job, let alone do your documents, if that makes sense. But honestly, like it is going to be difficult getting your stuff signed off, but you've just got to keep pushing and pushing and pushing, because if you don't get those stuff signed, then you could potentially fail your placement. I mean, it might be a bit awkward constantly nagging them to sign and do your documents, but if something like you just have to get done, like we just don't have a choice. But one thing to make it 10 times easier is when you're at home, fill out absolutely everything you can. Fill out everything you can do yourself at home, and then bring your document in the next day and be like, right, show it to your mentor and be like, okay, this is what I've done. These are the bits you need to fill out. Like, please, when you have time, could you do them? Just give them notice that they need to fill it out, and also show them that you've also put in the effort, and then they're probably going to be more inclined to want to sit down with you and do those documents. So guys, I thought I'd end this on a positive note, but this degree really does boost your confidence. I sort of came into this degree doubting myself that I'd be able to be a nurse, just because it's so much responsibility, and not just for your patient, but you're leading a team of people, you're managing a ward, and that is scary to me. But the placements, as scary as they sound, they are a literal godsend. Like, it just completely throws you into it, and your confidence will shoot up. You will feel ready to be a nurse by the end of the 3 years. So please don't doubt that you can do this job. You definitely can if you've got the passion, if you've got the willingness to learn. That's all you need to be a good nurse. Thank you for watching this video, guys. Please subscribe to my channel. Also, thank you to everyone who has already subscribed, and leave a like and comment below what other videos you want to see from me. So yeah, thank you for watching. I hope this video helped you, and I'll see you soon.